Hello, my name is Ellen, and I am a dental hygienist practicing in Basalt, Colorado. I have been in general dentistry for 16 years, and I started working with a holistic biological dental practice about a year and a half ago. It has been an exciting new path in dentistry for me to explore. This presentation will discuss a holistic biological approach to caring for a patient in orthodontic treatment. This topic is of particular interest in me as I have recently started my second round of ortho. Biological and holistic dentistry is a whole body approach to dentistry that includes the materials, the procedures, and the techniques used to provide care. It takes into account the relationship between oral and systemic health and looks beyond conventional dentistry to achieve the best, most complete oral health care for the patient. Orthodontic treatment uses gentle pressure on the teeth by arch wires or clear aligners. The two most common methods are traditional braces and clear aligners. Traditional braces use brackets that are stainless steel, gold-colored, or ceramic, and arch wires that can be made from stainless steel, nickel titanium, or copper titanium. The brackets hold the arch wire in place, and the wires cause gentle pressure on the teeth. Clear aligners use a combination of plastic trays and tooth-colored bonding material to apply pressure to the teeth. Over time, the jaw will adapt and conform to the pressure. The movement of the teeth during ortho treatment is a result of the breakdown and reformation of bone that results from this pressure. Key topics to consider with the patient in orthodontic treatment are periodontal health, diet nutrition, energy flow disruptions, and ozone therapy. We know that orthodontic treatment can affect the balance of oral microflora because of increased bacteria retention with fixed brackets and arch wires. They are difficult to clean around, and patients may not be compliant with the consistent home care that is needed to keep bacteria levels controlled. The presence of plaque is one of the primary risks for inflammation and gingivitis during ortho. The brackets and elastics can directly contribute to increased plaque retention. Increased plaque retention can lead to gingivitis and periodontal disease. It can lead to an increased risk for demineralization, decay, and dental infections. Visible demineralization has been shown to appear as fast as 4 weeks after the placement of brackets. It is essential to maintain good nutrition during orthodontic treatment. This may be difficult due to limitations with food choices during treatment. It may be beneficial for ortho patients to consult with their medical doctor, naturopath, or nutritionist during orthodontic treatment. Some foods may be difficult to eat due to the brackets and wires and soreness that can result from treatment. Other foods should be avoided altogether to avoid damaging the appliances and increasing the risk for decay. Foods to avoid include anything chewy, hard, sticky, or crunchy, and foods high in sugar that can increase the risk for decay. Foods to include in the diet are foods high in vitamin C and D, and foods containing vitamin A, calcium, phosphorus, and magnesium. Vitamin C prevents bleeding and inflammation in the mouth. It is beneficial for periodontal health and wound healing and affects the retention of orthodontic treatment. A lack of vitamin C can interfere with collagen synthesis, which can affect the periodontal ligament and the formation of osteoid. In one study, patients with the lowest vitamin C levels in their blood showed a 30% greater risk for gum disease. The increased risk for inflammation and lack of collagen associated with vitamin C deficiency may lead to orthodontic relapse. Some good dietary sources of vitamin C include oranges, sweet potatoes, leafy greens, red and green peppers, broccoli, Brussels sprouts, and tomatoes. Vitamin D is actually a hormone and is involved in the formation of the hard tissues of the mouth. It is essential in helping the body absorb and maintain calcium. Vitamin D helps to maintain the serum calcium and phosphate production, which are needed for bone mineralization. Good bone support is needed to maintain the dentition and support facial muscle strength, which is needed to help maintain occlusion and airway. K2 can be beneficial in conjunction with D3 in promoting the absorption of calcium. Vitamin D deficiency may contribute to a slower rate of tooth movement during orthodontic treatment. Some good dietary sources of vitamin D include eggs, cheese, yogurt, milk, and fish. Vitamin A helps with saliva production and maintaining the oral mucosa. We know that dry mouth can increase a patient's risk for decay and inflammation, and good saliva flow during treatment is essential to protect the teeth and gums. Topical vitamin A may be beneficial in reducing gum irritation during ortho treatment. Some good dietary sources of vitamin A include liver, leafy greens, sweet potato, and eggs. Calcium, phosphorus, and magnesium are essential minerals found in teeth and are needed for bone support. Some good dietary sources for calcium are dairy products, broccoli, spinach, and tofu. Sources for phosphorus are dairy products, beef, chicken, salmon, and eggs. And sources for magnesium are whole wheat, spinach, quinoa, eggs, avocado, and banana. With any dietary recommendations, it should be recommended that a patient consult with their medical doctor, naturopath, or nutritionist to develop the best plan for their overall health. Patients would need to take into consideration any allergies and possible food and drug interactions, and consider testing levels of vitamins and minerals that may be recommended prior to orthodontic treatment. We know that ozone has a strong antibacterial and wound healing property. Ozonated oils, such as ozonated olive oil, can be beneficial for patients experiencing gingival inflammation that can occur with ortho treatment. Ozonated oils have contributed to improvement in tissue health of patients with ANUG. Ozone water irrigation during routine hygiene visits is highly effective in killing harmful bacteria that contribute to gingivitis and periodontal disease. Ozone application has been found to be beneficial for sensitivity, making it a useful treatment for sensitivity experience during ortho treatment. Qi is the invisible energy flowing through our bodies and may be disrupted by metals in the mouth. Orthodontic brackets may contain nickel, chromium, and cobalt, and arch wires can be made from stainless steel, nickel, titanium, or copper titanium. Excessive current can contribute to insomnia, anxiety, emotional sensitivity, and digestive issues. Patients may benefit from allergy testing prior to ortho treatment, and consideration should be taken in evaluating a patient's load burden to see if they can handle this sort of disruption. Patients may benefit from an evaluation of their airway prior to orthodontic treatment so that it can be addressed during treatment. Many patients are not aware that airway issues can be improved with orthodontic treatment, and a patient should be encouraged to discuss possible airway issues and potential sleep disordered breathing concerns with their dentist and orthodontist, as well as their medical doctor. A consultation with a myofunctional therapist may be beneficial prior to or during ortho treatment to evaluate for tongue position and tongue thrust, which are both common reasons for ortho relapse when they are not addressed. Patients may also benefit from metal allergy testing to see how the materials used in their ortho appliances may affect their systemic health. It is essential that the orthodontic patient understands the direct relationship between their oral hygiene, oral health, and systemic health. Excellent oral hygiene is a key component in reducing plaque formation that can lead to gingival inflammation during orthodontic treatment. We need to ensure that the patient understands the importance of good nutrition during their treatment and how it relates to bone formation and retention of their treatment. We need to encourage the orthodontic patient to seek evaluations with their medical doctor and a myofunctional therapist to ensure that they will understand that orthodontic treatment is not simply cosmetic, it affects our entire system. Thank you.